So this Martin is a 10-year-old boy with primary molar in various stages of exfoliation. He has a mild crowding in the lower anterior segment. What is the first management of clinician to do? There's nothing here. Observe him for 6 months. Yes. What else can be the option? Yes. There's nothing in the scenario. Uh, it's the D, like what they are in the diameter. Okay. Which of the following and the clinical diagnosis of a tumor? Which of the following and the clinical diagnosis? I don't know. Yes. Yes. Yes, I think it's a latent period. Search. X-ray can lead to cancer. What is the period between exposure and the cancer called? It's called the latent phase. So that's actual question. Okay. Intraoral examination show teeth, all first permanent molars, narrow high arch palate, fissuring on the dorsal anterior two-thirds of the tongue, fissuring of the tongue. Because it's not in the clavicle dysplasia. On clinical exam, the patient presents with a flat face, occipital parietal bossing, hypertelorism, and sunken nasal bridge. This is not like a clinical dysplasia. Yes, but if you see the teeth are not present, like when they have combined it because it can be we can see the Gardner syndrome. Yes. Dr. Hani shared a question. It's up to Dr. Hani. Okay, by Yasir. A 20-year-old female. I'll add for Anas. Female patient attends for the assessment on a joint orthodontic osteotomy. She has a significant class 1 and requests loss surgery. In loss surgery or in loss surgery. which have, which he has looked upon the internet and YouTube. She has previously been diagnosed with a psychological issue. She has no family support and she attends with a social worker. What is the appropriate plan for this patient? No treatment can be offered. Liaise with doctor to arrange a psychotherapy to help her come in terms with the do not offer orthodontic treatment. She has a significant class 3, right? She has a significant, I don't know. Offer her complete compromise treatment using orthodontic alone. I think they have mentioned that there is a significant class 3, but it was something different. Offer without pre-surgical orthodontics. If the social circumference, they can provide care in the immediate post-operative recovery period. Yes, that can offer orthodontic surgery on after circular, and if the social circumference, they can provide support. Yes, E. A 16-year-old patient who is undergoing orthodontic treatment has cancelled the last 3 appointments to see you at short notice. She has she has fired appliances in place which have not been checked for several months. She has what? Fired? You elect your you asked
With
your
fixed
appointment to
appliances. She has fixed appliances in place.
okay, fix appliances. Yes, so proved. Yes. You asked the receptionist to phone her mother. Her mother explained that her daughter has anxiety issue and recently she cannot get her to leave the house even to attend school. Yes, I think this was a question you did. Yes. You can oblige to contact. You are obligated. It's option C. Because you have to contact the social services. For, in orthodontic wires, permanent deformation is first seen at yield point. It's written everywhere. No need for such questions. 5-year-old female patient was presented with scattered class 2 with prognathic mandible. It was planned to extract maxillary first premolar and do maxillary setback. Which procedure should be used? Prognathic mandible. No. Investment, it's we extract the premolars and move the maxilla backward. Yes. But it's a prognathic, it's a class 2 with a prognathic mandible. Yes. It was extraction of the first one and do maxilla set. The same, like, but it's a Westmont or Ventura procedure if it's a maxilla. Yes, they have mentioned class 2, so I think a patient presented OPD with a craniofacial abnormality. He has underdeveloped collarbone and is brachycephalic. Collarbone. What should be the first step in the management in the OPD with a craniofacial abnormality? Treat orthodontically. Refer to the tertiary setting. What the tertiary setting will do. Refer to the genetics. Refer the patient B or D. Then it's a B. Sexual results to take therapy. Set the unit X-rays, absorption, distortion. Let me see what he said. Okay, sorry. Okay, he said something. For this question, a 13-year-old patient with a mother came to your clinic for routine examination. उसने हमें शौकत ने मुझे वो किया उस पे किया कि इसका क्या you suspect infection of the upper right canine and root torsion of the lateral incisor. See, like, but you haven't taken any X-ray, so how can you suspect this, right? The left canine was suspect infection of the upper, partially impacted. Which extra X-ray you should brace for the first thing is you go for a periapical X-ray, right? How he judged this without taking an X-ray, right? Otherwise, the first X-ray should be mentioned and it should be written. Then you say that I go for a CBCT, right? The first line of accident, because you are doing it like from the statement, it seems like, but it's just an extraoral examination. So that's why it should be a periapical first. If there is a root option extensive, then he can go for a CBCT later on. It's B. C. Why not D? Though? We mentioned C for something. You need support from a adolescent. I think you go for the social services. We discussed this, that you go for the social services. It's the first line. It's in the guidelines, NHS guidelines. That either you go for the social services, and what was the second option? No, no. If the social service, yes, for worrying issue, social services, or you contact the social services or the GP to check on the patients, right? If there are worrying issues. So if there are no worrying issues or there is no history previously, you can look for the like what detail change in details or something like that. Like what if the family has a history of this one? She may have support from a. She may need support from a. I don't know what that means. 9 years skeleton deep to the insides. It's 119. I've solved this question by a video. You can see the video. I'm not going for this one. Already solved. Send me the guidelines, the social services. You are using a TMA to form bands. So it's formability. A. I think there's still some X. So this is open with a 13 years old child has fractured his twin block on several plane by playing. You will how many repeated appliance? Yes, make a new appliance. Option D. Sorry. After you have many repeated appliance. It's functional and if do not work, option A. Yes. If do not work, change the treatment plan. While performing its three, it's scaling and route planning D. D. So there's nothing, and open with. Yes. What do you, the number shown in the picture below indicate to the inclination? Therefore, stripping, yes, 0.5, 0.5, 0.5. So it's 1.75. Stripping that is need to be done in future because it's white color of the triangle. So it's 1.7 IPR needed to be done in the lower arch, not only the incisor, also in the canines, right? So, and that's in the future, not in this stage.
Sir,
Yes.
sir, here in the if the patient come with a multiple time with a breakage appliance, whether we should go for a fixed appliance or
Yes, we
whether
go
we
for a
should
fixed
give him
functional fast, fixed functional fast, right? We can go for a fixed function. There are two things. Uh, we should go for a fixed functional fast, or we can change the plan, right? If it's multiple breakage. Multiple breakage also show the compliance is poor. Mostly the British do not go for the fixed functional, like, but they can go for the horse. If you see the Cameron O'Brien randomized clinical trial, one chance is you go for the like, but the appliance has a loose retention or something like, but ideally it shouldn't be weighed during the contact sports, right? So we can use a fixed function, or the breakage of the appliance show that the patient has a compliance issue, and we can remove like, but change the plan. So I will first try the fixed functional. If it do not work out, I will go for the change of the plan.
So then, in which scenario we should go for using cold acrylic when
I
there
told
is
you
issue with the
I go
fitting?
first for the fixed functional, right?
Okay, sir.
If there's a multiple breakage because of the falling of the appliance during the contact sport, right?
Okay, sir.
because they mention about contact sport here. If the child is intentionally breaking it, we can just change the plan. So if there is a compliance issue, then like what it's a rugby. Let me think about rugby. So what do you think about rugby? Because the patient is a rugby player. Should we give a fixed functional appliance to a rugby player? Yes. I think we should change the plan. I will go through it and I will change the plan. Rugby player. The patient is a rugby player. Option E. Like what the question we got while playing.
Sir,
Okay,
one more
development.
thing.
Yes.
Like if usually when we give removable appliances, we tell them that clean, you have to take it out. So
Yes.
here the person has not taken it out, and they have done, because of that it got
Yes,
fractured.
compliance issue.
So here the, yes, sir. So mostly it
Also,
is
it's
compliance
a rugby
issue.
player.
Yes, sir. So basically we have to change the treatment plan, either fixed nor removable
Yes.
appliances. Fixed. Okay.
No, we are not going for fixed appliance because the patient is a rugby player, right? The scenario in that they said it's a rugby player. So we are going to change the plan because the damage would be much more severe with the fixed appliance then.
Okay, sir.
Okay, development of the skin skeletal shaft elevation in females, changes in the orientation shell to horizontal occurs at the 8 weeks, I think. Yes. 9 weeks F1, I think at 8 weeks the change. Yes. Yes, the position change within minutes. It's not days because the option you mentioned 1 week, 6 days occurs at the age of 1 week, no, 6 days, 6 weeks, 2 weeks. I think it's in 8 weeks. Yes, it occurs in minutes, so the options are not here. So I mentioned, according to the book of McDonald and Ireland, they are in the horizontal plate at the 8, start to become vertical orientation at 10. They start to fuse, so I think it's 2 weeks. No, the change in orientation within minutes, what is written in the literature. What is the position of impacted canine? You cannot tell it from one X-ray. GPR, social workers, already known, or child protection plan. You requested OPG from patient, then he brought it. You found that he has a recent previous one, which you will manage this situation. Do not inform patient as there is no big harm. Inform the patient that you tell him that there is no problem. Inform the patient, apologize, document the coincidence. Frankly, I do not understand the English. Inform the patient, apologize, and tell him that it will not happen again. You request an OPG from patient, then he brought it. You found that he has a recent previous one. I don't know. Sorry.
So doesn't it mean that he is already having an OPG and we have asked her for another OPG?
I don't know. Because he brought it, you found that he has a recent previous one.
Yes, sir, that he has the previous OPG and you have request for another.
So what's the big deal? Inform the patient, but tell him
Extra
that there is
radiations.
no problem. Do not inform. Might be if you have done a new X-ray and the patient brought another X-ray, ideally it's part of the records there, right? In the data flow. So if it hasn't been done, document the incidents and found out the causes. I don't know. Inform the patient, apologize, and tell him that it will not happen again. Obviously, you will apologize if you haven't seen the records, like what it was written there, and you have done it again. So the patient underwent a radiation exposure. Okay, I think there are no more questions here.